Hi everyone, I'm Dr. Amanda from Veterinary Center in Parker, and this is Paisley, and we're going to be talking to you about ear infections today. So the first thing I'm going to start with is just how to check your dog for ear infections while we have Paisley's patience. So really easy, just flip up their ears. If their ears are already standing up on their own, even easier. And just look inside their ear. Hers looks nice and clean. We want it to be this soft pink color. If your dog has black pigmented skin, it'll be a darker color. See how there's no debris in there? It looks really good. Same thing on the other side. You can smell it too. If they have an ear infection, it'll get really smelly. So I'm going to let her get down because she's going to get wiggly, and then we can keep talking. So what causes ear infections? Kind of two big things. The main one is allergies. So if you're interested in more learning about allergies, go watch my other videos that came out earlier this spring. But allergies break down the skin barrier and make dogs susceptible to skin and ear infections. The other thing we can see is water. So swimming, baths, things like that, water that gets in their ear, stays in their ear, can lead to infections. So if your dog has a lot of hair in their ear that's trapping that water in, that can lead to that as well. So what are you looking for? We already saw what a normal ear looks like, but you want to look for any shaking of the head, scratching at their ears, yelping when their ears are touched. If you lift up their ear, you'll see that there's a lot of brown waxy debris. It can be red, it can be irritated. You can see scratches on the inside of their ear from them scratching so much. So just take a peek pretty regularly. Often you'll start to smell it too if they have a really bad ear infection. So I also wanted to show you what the ear looks on the inside. So in dogs and cats, the ear canal is an L shape, dogs more so than cats. So this is the outer ear. In this dog, the ear is standing straight up. And then it comes down, it bends, and then goes over to the tympanic membrane or the eardrum. Same thing with the cat. And it bends a little bit, just not quite as much. So how do we treat ear infections? And usually there's two modalities that we want to look at. One would be cleaning the ear. We got to get all that gunk out or else the medication's not going to penetrate the way it needs to. So when you clean the ear, you use the bottle, squirt it in, and then kind of squish the base of the ear, rub it around really well, let them shake it out, and then wipe out any excess with a cotton ball. Then give it 5-10 minutes for it to dry out, then you can put that ear medication in. Now, how do we pick that ear medication? How do we pick what cleaner? Because those are medicated cleaners as well, and that is really based off of the cytology. So what we do is we take a cotton swab, put it in the ear, get a sample, and then look at it under the microscope, and that'll tell us if there's yeast or bacteria. If there's white blood cells, that's a really good sign of inflammation. And we use that to pick which medications accordingly. Some doctors may not want an ear cleaner based on how much debris there is. If there's not a lot of debris, we may be able to adjust the ear medication. The other option that we have for medications is long-acting ear medications. So those are something that we would do here. We would clean out the ears really well and then apply this medication. Depending on the medication, some last for 2 weeks, some last for 30 days. And so those are great options for those dogs that don't let you touch their ears, whether they're really painful or just they don't like their ears being touched. That really is a good option because then you don't have to do anything at home. Now, for those dogs that get chronic ear infections, likely due to allergies, so if you have more questions, go watch those allergy videos. But ways to try and prevent that would be weekly cleaning. So cleaning those ears every week, even every other week can do the trick. That way you're really looking inside them, you're really getting any excess water, excess debris, especially after baths or swimming, definitely clean those ears out. There's a lot of ear cleaners that you can get over the counter. Even just water and apple cider vinegar, 50-50 mixture can work. Sometimes we need something a little bit stronger, and that's where our medicated ear cleaners come in, and especially for those dogs that are getting recurrent ear infections regularly. One of the consequences that we can see with ear infections is from them shaking their head so much as they get what's called an ear hematoma, also known as cauliflower ear in people, where the ear will swell up. It gets fluid in between the cartilage. So that's another reason why it's really important to check those ears regularly. If you do notice an ear infection, don't wait. Bring them in as soon as you can, so that way we can get them started on cleaning and medication, so that way we can help them and prevent worse side effects from that. So please give us a call or email us if you have any questions. We are happy to talk about ears, talk about ear infections, talking about allergies, anything you have going on with your pets. I know I did briefly mention cats as well. The medications we can use in cats are a little bit more limited. We see ear infections less frequently in cats too, most commonly in dogs. But not to say we don't see it in cats. Cats also get ear mites more commonly than dogs, which is another cause of ear infection. So also something to look out for. Again, reach out to us if you have any questions.